Fertility. What is the definition of infertility? Infertility is failure to conceive within 1 year of regular unprotected intercourse. Unprotected means not using any condoms or birth pills, birth control pills. Primary or secondary? Primary is when a woman had a normal pregnancy beforehand. Secondary is when a woman, primary is when a woman never had a pregnancy ever in her life, and that's called primary infertility. Whereas secondary is when a woman was previously fertile, had become pregnant. Whether she delivered a normal child or not is not important. She might have aborted, but then she ever became fertile and became pregnant is called as secondary infertility. After now, the causes of infertility are ovulatory disorders, which forms the major factor, that is 31%. Then male factors, that is oligospermia or tuberculosis of the genital or gonorrhea, and then tubal diseases of the fallopian tube. Unexplained causes form a significant 15% of the chunk, and others like 13%, like ill health, diabetes, hypertension, and then these factors, psychological factors. The management. Now, the first thing about infertility management is the history. Couples should be seen together and reassured. Women's age and duration of infertility should be assessed. Any history suggestive of a cause should be found out. Investigate after 1 year of failure to conceive. Investigate sooner if greater than 35 years of age or history suggestive of problems. Examination. Examination. Females are the BMI, that is the base the how fat the female is, and then hyperandrogenism, galactorrhea, pelvic abnormalities. Males, like assess genitalia if history is suggestive of, or semen analysis if it's abnormal. Then reassure the woman with regular cycles. Advise if she is having regular cycles, reassure her. Advise retiming and frequency of intercourse. Avoid alcohol, smoking, and drugs, and give folic acid and maintain the weight. Baseline investigations for females are follicular phase, luteinizing hormone, follicle stimulating hormone, and estradiol. Luteal phase, progesterone, rubella test. Consider tubal patency test like chlamydia test first. Males like semen analysis, and repeat at 3 months if abnormal. Now, the volume of semen should be more than 2 ml. The pH should be 7 to 8. Concentration should be more than 20 million per ml of sperms per ml. Motility of the sperms, of all the sperms together, should be at least 50% of them should be moving forward, and more than 25% of them should have rapid linear progress. Morphology, more than 15% of them should be normal, more than 50% should be alive, and anti-sperm antibodies should be absent, and the white cell count should be less than 1 million. Treatment of infertility for male factor is hypogonadotropic hypogonadism. The causes can be hypogonadotropic hypogonadism. Then the treatment is gonadotropin. Obstructive azoospermia, the treatment is surgical correction. Obstruction of the vas deferens basically needs surgical correction. And correction of varicocele, which is basically worm-like appearance in your testis, which is called as a bag of worms, which is basically dilatation of the veins which drain the testis. Anovulation. Anovulation treatments can be when a woman does not ovulate, does not produce, able to eject her eggs. And the treatment is clomiphene, which is at day 2 to 6 for up to 1 year. Monitor with ultrasound for the first cycle. Gonadotropins, FSH for 10 days, followed by HCG. Ovarian drilling, metformin. Tubal disease, ablate endometriosis at the time of laparoscopy, tubal surgery, and IVF. These are the treatments for tubal disease. Intrauterine insemination used in inexplained or mild male factor infertility. Outcome may be no better than expected management. IVF is the treatment for the treatments are pituitary suppression by GnRH agonist, superovulation by FSH hyperstimulation, HCG to mimic the LH surge, oocyte collection, fertilization and incubation like ICSI, embryo transfer 48 to 72 hours later, luteal support with progesterone. These are all the treatments of IVF. Now, this is a strip which shows whether a woman is pregnant or not. This is called as the clear blue strip. Now, the take-home baby rate is 20% per IVF cycle. Consider alternatives like oocyte sperm donation, surrogacy, and adoption. Now, let me tell you a little bit more about IVF. IVF means in vitro fertilization. In this, what happens is there are two types, either frozen egg or fresh eggs. Now, what happens is if you use the fresh egg technique, the woman is first given a lot of medications for her ovaries to become large and ovulate. And once she ovulates, her eggs are taken out immediately and then put in a petri dish. The male is told to the husband is told to ejaculate at that day immediately, and both of them are fused and again put back in the uterus of the woman, and the woman becomes pregnant at that time, and that's called a fresh egg embryo transfer. Whereas a frozen embryo transfer is something where one cycle the woman's egg is taken out, it's kept in a refrigerator, then the man's sperm is taken out, they are both are fused together, then the haplocyst blastocyst stage of the basically a zygote is formed, and that zygote is transferred into the woman in the next cycle, and that is called as the frozen egg cycle. People say that the fresh egg transfer has a higher success rate, but then again there are plenty of studies which say otherwise too. And then once the transfer is done, then after 14 days the woman becomes positive, then it's considered to be a successful IVF pregnancy. Please remember that IVF pregnancy, generally we try to keep 3 embryos inside, live embryos, because the chances of failure are high in these women and at least one should survive. But anything more than 3 is not recommended, because multiple pregnancies generally lead to abortion and failure of the pregnancy in toto in second trimester. And other things are, the woman might need a cervical stitch later if she develops twin pregnancies, and to prevent a premature abortion, a premature delivery. So these are the things which have to be kept in mind. And IVF is a journey. It is not a single step where you go one day and you get pregnant. No, it's a whole journey which needs to be taken by both the husband and the wife. Thank you.